Hello, and welcome to our presentation on the legalization of THC and CBD and its effects on public health. We will be exploring how this health effort translates in major organizations and how leadership can expedite the process of legalization. As of today, marijuana is classified as a Schedule I drug by the federal government. Schedule I drugs are any substances that have no current acceptance for medicinal use and have a high potential to be abused. Substance health use disorders greatly impact underlying mental health disorders, but denying the legalization of marijuana raises larger public health concerns. Studies show that increased use of marijuana exacerbates symptoms of schizophrenia, depression, bipolar disorder, ADHD, OCD, anxiety, and PTSD. However, many health professionals are already prescribing THC or CBD products for chronic pain, chemotherapy-induced vomiting, and epilepsy. People with serious mental illness may experience adverse effects to cannabis, and the likelihood of developing an addiction is increased. For example, PTSD patients experience mixed reactions to the effects of cannabis. Some find that it alleviates insomnia symptoms, but others notice that it only worsens them. They also find that it might heighten their PTSD symptoms and only find relief when abstaining from marijuana. In the US, 24 states plus the District of Columbia have legalized marijuana for medicinal or recreational use. As we've seen, the adverse effects on mental health raise concern for the federal government to legalize the product. However, the prohibition of cannabis products contribute to increased criminal activity and causes harm to individuals through harsh imprisonments, marginalization of minorities, and it creates barriers to treatment. Even though white and Black Americans use cannabis at about the same rate, the latter are 3.7 times more likely to be arrested for possession. Prohibiting cannabis products also poses societal constraints through high policing of the product and increased court and prison costs through increased local taxes. There is a public health responsibility to uphold when legalizing THC or CBD products federally. The legalization framework should explicitly outline delayed onset by youth, reduce risky behavior and demand, reduce stigmatization, decreased rates of problematic use and concurrent use with other substances. The organization chosen to support the efforts in legalizing cannabis is the National Institute on Drug Abuse, or the NIDA. They studied this relationship between marijuana use and mental health outcomes, particularly how it affects psychosis, depression, anxiety, and cognitive impairments. Their research aims to understand the mechanisms underlying the effects of drug abuse, identify risk factors, and develop intervention to protect potential harm. Through means of THC or CBD and mental health research, the NIDA also develops educational awareness and outreach materials to increase awareness of the harms of drug abuse. They also provide scientific research to policymakers. The mission statement of the organization is greatly important when considering the efforts in legalizing THC or CBD. They directly use their research and scientific findings to support public health initiatives and provide knowledge on addiction science to improve individual health.
Thank you, Krista. Next, we will discuss the Director of National Institute on Drug Abuse, Dr. Nora Volkow. Dr. Volkow has pioneered the utilization of brain imaging to investigate the effects that drugs have on the brain. She has advocated and demonstrated that drug addiction is a brain disease. Dr. Volkow specifically studies addiction to understand what happens within the brain when a person loses control. Her interest was understanding how drugs changes a person's ability of self-determination and self-will. What was found was that substance use disorders are a social problem and a brain disease. Different factors in society have power to create conditions for people to be vulnerable to addiction and also have power to begin recovery. This does not stop the fact that addiction is a chronic brain disease. A quote from Dr. Volkow is, "Research shows that when people end up in jail or prison, they have a much higher chance of overdosing, dying, or relapsing. Some leadership qualities that Dr. Volko radiates is being a transformative leader as the director at the National Institute on Drug Abuse. Her commitment to drug abuse research comes from her family's history of alcoholism. Above the dark history behind them, the Volko family also consisted of many scientists who sparked her passion for science and urology. Dr. Volko exemplifies empathy because when in medical school, she notes in a particular interview that she was upset at the lack of curriculum covered on substance use and addiction therapy. Dr. Volko welcomes other viewpoints and consults other fields of study when conducting research. Because of this, it allows for more room for knowledge as an abstract thinker. Many of the research and scientific breakthroughs discovered by Dr. Volko and her team are to better that of public health and individuals suffering from substance use. This level of integrity is greatly important in a leader. Dr. Volko is a pioneer of using brain imaging for substance use disorders. This relates to her innovation in her leadership because she conducts further research with similar abstract thinking. The scope of drug abuse and the physiological effects of addiction in the brain is too limited and can be seen as an area of improvement in a leader. While Dr. Volko often tries to mitigate this by meeting with politicians, professing, leading teams, and holding other chairman positions, these things support her research and enrich her community involvement. However, this may be seen as opportunistic and overzealous amongst her teammates because she may not be able to provide the same level of attention to them. Being overly connected to the subject matter may also come across as biased and affect her work. Her family saw alcoholism as some unspoken word. However, it has fueled her research to find out why this occurs in some people's brain and not in others. Lastly, here is our reference slide to include all the references that we use today in our presentation. On behalf of our group, we want to thank you for listening to our presentation today regarding the legalization of THC and CBD and its effects on public health. Thank you.